We all share the same dream: to create better lives for young people. For the past 20 years, my team and I have made an effort to understand how. Our focus has been on disentangling the complex interplay between different societal institutes, the family, the school, the peer group, in order to identify risk and protective factors for adolescent health, well-being, and behavior. We have published over 100 papers in international journals, and part of our findings have been used as a base for a primary prevention program targeted at decreasing the likelihood of substance use among young people. And that's the story I want to tell you here today. So we start in the year 1997. It's a Saturday night in June. Downtown Reykjavik is full of adolescents at 3 a.m., full of intoxicated adolescents. At the time, over 40% of Icelandic 15-year-olds have become drunk over the past 30 days. 20 years later, in January 2017, Iceland makes the headlines in the world news. It says, Iceland knows how to stop teen substance use, but the rest of the world is not listening. I tell you, they are listening now. So what happened between those two time points is what I would like to tell you about. So we go back to 1997. 42% of 15-year-olds have become drunk in the past 30 days. 23% are daily smokers. 17% have used hashish once or more in their lives. Through the 90s, substance use had been increasing constantly. And at that point in time, a group of researchers, policymakers, and practitioners working with children and adolescents decided to gather their strengths, try a new approach, and see whether it might be possible to reverse the negative upward trend in substance use among young people. The project that they came up with was called Youth in Iceland, and it has 3 core elements. First, it is evidence-based. So for us to know where we're going, we need to know where we stand. Far too many policies and prevention efforts have been written and carried out with no or even negative results, since they were not based on understanding and knowledge of the people or issues they were supposed to affect. They were not based on solid research. Our second core element was using a community-based approach with focus on changing the social circumstances of young people, and through that, affecting their behavior. And the last one was to create a dialogue between research, policy, and practice. We wanted to change what we believed looked too much like this, where research, policy, and practice are 3 separate aspects, with scientists publishing their findings, not knowing or often not caring much whether they come of any use in society, into this, where people combine their efforts and knowledge to create a system that can benefit young people. First and foremost, we needed to understand what indeed we were dealing with. We needed to understand young people and the world that they live in. So in line with that, we started carrying out comprehensive studies among young people, and we learned both from those studies and also studies that our colleagues had been carrying out in other places of the world. And we learned a lot. In many ways, our findings were in accordance with the logic of delinquency theories and studies carried out in other countries. In some ways, Icelandic circumstances were unique and needed an Icelandic tailored prevention policy. We, for example, learned that Icelandic adolescents, along with their Scandinavian and British peers, consumed alcohol differently than other European teenagers. Whereas 1%, 2%, or 3% of 15-year-olds in Southern Europe had become drunk 10 times or more, the proportion among their Icelandic peers was over 20%. Similarly, unwelcome incidents like accidents or injuries related to alcohol consumption were more common in Iceland than in most other European countries. A part of the explanation was a very liberal view towards adolescent drinking that was found in Iceland and needed to be changed. So we started studying the risk and protective factors, and we learned. We found that the role of parents is vital. There are 3 parental factors that seem to be of most importance in predicting or decreasing the likelihood of substance use: perceived emotional support, monitoring, which is not the same as rule setting. So adolescents whose parents know where they are and with whom are less likely to use drugs than adolescents who are monitored less. And the third family factors of great importance turned out to be the amount of time spent with parents. The more time adolescents spend with their family outside of school, the less likely they are to use drugs. These findings may sound intuitive, but was extremely important in Icelandic circumstances, because it has been measured that when given the choice of more leisure, more time spent with family, or more work, Icelanders tended to choose more work. So a nation who takes pride in working long hours and counts every spare hour as an hour wasted needed to hear that actually it does matter the amount of time we spend with our kids. We also learned that the influence of the peer group is negative, no matter how we look at it. Having friends that drink, smoke, hashish, or use other drugs increases the likelihood of similar behavior among the adolescents themselves. On the other hand, the influence of extracurricular activities is beneficial. The more time adolescents spend in organized youth work or sports, the less likely they are to smoke, drink, or use other drugs. And I tell you, it became so important for us with, at the time, new statistical methods. We could figure out both the effects on the individual level, but also on the neighborhood level. And we realized that this also works on the neighborhood level. So let me tell you what that means. So when we were going out speaking to parents, people used to say to us, you're only going to meet the parents who you don't have to speak to. The other parents are not going to show up. So when we found out that in schools, where parents keep close contacts by knowing the friends of their kids and the parents of those friends, the kids in general are less likely to use drugs, whether or not their parents are part of that parental network was very important. So we don't need all the parents. We just need to form a group of some of them. We learned more. We learned, for example, that substance use follows cohorts. So a cohort that measures above average in substance use at the age of 13 keeps up the use through high school and is also heavily using substances around the age of 15 or even 18. However, a 13-year-old cohort that starts lower also ends adolescence with lower substance use. Lessons for policy: it is very important to reach out to younger adolescents, to parents of younger kids, in order to postpone the moments in the lives of young people when they have their first drink. And I want to emphasize this because we are waiting for Mary's 1 million empathetic kids who are now turning 20, or over 20. So that is going to follow cohorts, and we're going to see a different world. So look at this here. If we compare the group in 1998 of 15 to 16-year-olds that had become drunk in the past 30 days, and we compared it to high school students in year 2016, we see that it travels upward in a wonderful way. So in year 2000, the proportion of high school students 16 to 20 years old that had never gotten drunk was 18%. In 2016, it was 46%, so almost half of our 16 to 20 years old have never become drunk. And this is important because this is a quote from NIH. People who report starting drinking before the age of 15 are 4 times more likely to report meeting the criteria for alcohol dependence at some point in their lives. So postponing the moment when they start drinking is very important. So we're talking about primary prevention. We're not saying it's not important to clean the floor when a sink is leaking, but we're saying it's also very important to repair the sink. So based on these findings, a program was set forth, and the program consisted of multiple different tasks in society. The focus was on changing the social environment of youth, and through that, affecting their behavior. Many policy changes were made at the community level within the capital of Reykjavik and across the country. NGOs were formed. Their efforts sought to promote collaboration between parents and schools, encourage parents to spend time with their kids. The focus was on reaching out to parents with clear messages related to the findings of the studies. For example, on the importance of spending time, that all teenagers should be home by 10 o'clock in the evenings, and that unsupervised adolescent gatherings should be avoided. At the neighborhood level, an example of a project was Parental Watch, where parents formed groups during weekend nights and took walks around neighborhoods to, in a friendly way, monitor the behavior of youngsters. At the community level, participation in organized youth work and sports was encouraged by offering adolescents prepaid cards to partake in structured activities. And at the national level, media campaigns were launched. The president of Iceland started a prevention day with, where he went out one day a year to reaching out to all the schools with clear messages on spending 1 hour a day with your kids, that some organized sports and youth activities were encouraged, and by saying to the adolescents, you're never gonna drink, just wait until you're 18 and then decide whether you want it or not. And soon the tide began to turn. Adolescents started spending more time with their parents, both on weekends and working days. Monitoring by parents increased. Adolescents were coming home earlier in the evenings. They're getting more support from their parents, and unsupervised gatherings are less frequent than before. and participation in organized youth work and sports increased. And the best thing, substance use has gone down to almost nothing. This has happened at the same time as substance use among adolescents in many other European countries has been increasing. Iceland was the only one out of 20 in the ESPAT study to experience consecutive reductions in alcohol use during the last 30 days from the year 1997 to 2011. And the pattern is very clear. We see we are there at the bottom with 5% of 15 and 16-year-olds having become drunk. The other bars are our collaborators in Europe, other European cities. And when they say to us, but isn't it because you're so strange up there in the north? We say, well, you see, in 1998, we used to be here. So our situation was much worse than yours is today. We also, and remember I showed you this before, look at our neighbors at the top, our Danish neighbors. They are still at the top. So in 2015, 8% of Icelandic 15-year-olds had become drunk, while 56% of Danish adolescents had become drunk. And these are our close, what would you say, relatives. These are the guys we actually fled from. So lastly, what happened was that at the start, when we started this program, not everybody wanted to take part. We were rather annoyed at the start, but afterward, it gave us a valuable opportunity to compare the communities that had been working on this to the ones that did not. And we saw a significant difference on all the measures that we were studying. Actually, I just included this slide because this is something that kind of came as a surprise, but there has been a wonderful decrease in other related behaviors. So bullying has gone down by a lot with this community building approach. So what started as youth in Iceland kept on as youth in Europe and is now called Planet Youth. We are working in 35 cities around Europe and just started work with colleagues in Santiago in Chile. So no longer youth in Europe, but moving over to South America. Together, we're heading into this new phase where we're going to try to figure out whether we can make similar principle work in different places by mobilizing local societies and creating circumstances that can influence the lives of youth in a positive way. Because we know that it is only that way we can go. In a world where there are practically no cultural or national boundaries anymore, and cyberspace is without limits, in this kind of world, it is only through joining forces, by learning from each other, and by basing our work on evidence that we will succeed in creating better lives for young people. It is not an easy task. We're not going to change anything, as Mary points out in her book, by single project solutions. Prevention needs to be long-term, consistent, and comprehensive, not one campaign, but more like a quiet revolution. Thank you.